तोंडाने श्वास घेतो. संजू सेशन रेकॉर्डिंग दिसतंय तिकडे.
नाही सर.
डॉक्टर संजय
नाही दिसत.
नाही दिसत रेकॉर्डिंग नाही दिसत.
सर तुम्ही सगळ्यांना म्यूट करा. सगळ्यांना म्यूट करा सर.
ओके, सो विदाउट वेस्टिंग एनी टाइम आय विल जस्ट
Yes,
प्रोसीड.
sir.
So we can see the rubric A, albuminuria in Phatak repertory. Let me know the page number of the rubric albuminuria in Phatak repertory, and what does it means albuminuria according to you. You can type in chat box or you can unmute yourself and let me know your answer.
सर मैं रोज से बैठा लेकिन 5:30 रखा जितनी जल्दी क्या है
Okay, so I am not getting any responses from you. So I will continue with one side only. So the rubric albuminuria. So what does mean by albuminuria? So it's presence of albumin or protein in the urine reports. Many times patients visit to your clinic with the reports and just they will say that doctor give me some treatment to this. So what we need to do in such a cases when the symptoms are very less with us. So we need to refer Phatak repertory in such a cases. So the clinical presentation of albuminuria is nothing but the whenever the patient passes urine in the pot, then the urine will be frothy. So the foamy or frothy urine indicates that patient is passing albumin.
सर आवाज येत नाहीये सर.
So here we can have the rubrics, the reports patient will come. If the patient is exhausted physically, then you may see 1+ protein in his reports of urine. Then you don't need to go with that thing that the reports are there of 1+ and you consider that case as a case of albuminuria. So in albuminuria, there is one rubric, alcohol abuse after. So albuminuria, alcohol after abuse of. So what does mean by abuse of alcohol? It is excess quantity of alcohol consumed by the patient over a larger period of time. So there are some remedies in this rubric. Two remedies are there on page number 11. So first remedy is arsenic and second is carbovage. So we will first go to the page number 36 in Phatak Materia Medica. You have to open page number 36 of Phatak Materia Medica. Arsenic album.
Yes.
सर तुमचा व्हिडिओ दिसत नाही बरं का.
Sorry, it's page number
Page number 87, 86, 87.
Page number 86, you will open arsenic album.
Old
So
69.
the patient comes to you with the reports of albumin and he has the history of abuse of alcohol. Then there are two remedies. One is arsenic and second is carbovage. So we need to differentiate which remedy should be given to which patient. So on in arsenic, if you see, then the arsenic patient will have the urination very scanty, but the patient of carbovage, you will have copious urination. So this is the differentiating point. So this is the differentiating point between both of them. So on page number 184, you can go and see carbovage. On page number 184 of Phytolacca remedica. So what does Dr. Phatak writes over there in urinary section, that albumin in urine, nephritis, septic from alcohol. So in cases of septic nephritis, that too from abuse of alcohol with albumin in urine, and urination is very copious. So in such a cases only you can consider to go with this remedy, that is carbovage. And one more thing you can add in carbovage, that the patient should have, patient must be of the what we can say of old age. Then remaining symptoms of carbovage, if you get, then it will help to have a totality over there. Then the next sub-rubric comes in the under albuminuria is albuminuria, heart diseases from. So there is one remedy, single remedy is there, that is Calcarea ars. So Calcarea ars is there on page number 150. So please open page number 150 of Phytolacca medica. Can someone try to read out what is there written?
Kidney region
sir.
sensitive to pressure, passes urine every hour.
Can somebody please read out?
So
Kidney region
sensitive to pressure.
sensitive to pressure, passes
pressure.
urine every hour.
Every hour.
Passage of urine is every
Unmute
hour.
yourself and please stop.
Kidney region sensitive to
So in
pressure.
Calcarea ars,
and
if you
passes,
see
yeah.
the fourth line in Matra Medica, in complaints of drunkards after abstaining. So patient was taking alcohol on daily basis. He has stopped his alcohol, and then the complaint started. What types of complaint he has started with? That is nephritis again, albuminuria, and dropsy. So these are the cases of alcoholic liver cirrhosis according to allopathy or according to diagnostic point. Then if you go further under Calcarea ars in urinary, then there is written kidney region is sensitive to pressure. So patient won't be able to bear the pressure on kidney region. And most important thing, that he passes urine every hour. So this is the important thing, and this can be the totality to prescribe Calcarea ars in cases of albuminuria in alcoholic patient after abuse. Then the next subrubric in this list comes is albuminuria, diphtheria after. So there is one remedy written that is Phytolacca. So you will open page number 560 from Phytolacca medica. So what exactly Dr. Phatak sir writes about Phytolacca? Page number 560.
Albuminuria after diphtheria scarlatina, urine stains the cloth yellow, heartache in kidney with
So
scanty
somebody
suppressed
unmute and
menses.
please stop. I'm not getting anyone's voice over here. So on page number 560, Dr. Phatak writes heartache in kidney with scanty suppressed urine, dark red urine, chalky sediment, and albuminuria after diphtheria or scarlatina. So diphtheria and scarlatina are okay, Dr. Sade, I am unable to hear. So I will correct this in the next session. After this one, I cannot hear anyone's voice from your side. So I will continue the session as this only. Okay. So in urinary,
Sir, you just need to
so I was talking that
unmute.
diphtheria and scarlatina are not so common diseases in today's world. So we can consider the same scenario when the patient is having history of what we can say streptococcal infection. So streptococcal infections are most common in respiratory tract, and secondly, they are common in what we can say in skin. But we have to consider that the patient will what is the presentation given on page number 560. If you know the diagnosis in pediatrics, mostly the diagnosis by the pediatrician remains as post-streptococcal glomerulonephritis. So that is in short form, it is called as PSGN. So if cases of PSGN comes to you, especially of pediatric age group, and they are having history of streptococcal infection, so there will be a gap of 1 week, 1 week or 10 days in respiratory tract. If the patient has got a respiratory tract infection, and then after 8 to 10 days, 1 week or after 10 days, he is getting those urinary symptoms, then you can consider in those cases the remedy Phytolacca. But what will happen in cases of skin streptococcal infection? Patient will require more than 3 weeks or up to 3 weeks. So you need to go into the history of the patient, that whether the patient is having history of respiratory or skin trouble, and after that this was started. So in skin infection, impetigo and whatever infective eruptions or infective skin diseases we are seeing in our day-to-day practice, they are prone to have the staphylococcal more and streptococcal lesser. So you can go accordingly. Then the next subrubric in that section goes albuminuria, pregnancy during. So there are some remedies, but I will talk about the differentiating features of commonly used remedies in our practice. So first remedy we use commonly in our practice is Apis mellifica. So you can open on page number 61 from Patak Materia Medica. I already told before joining that the both of the books are mandatory if you want to really learn Patak. So if you open Apis mellifica, then the third line in Apis mellifica, Dr. Phatak sir writes, excessive swelling are the leading symptom for the selection of the remedy. So you need to have excessive swelling to prescribe Apis mellifica in many of the complaints. Then on page number 62, if you see there, then there is a great debility as if worked hard is compelled to lie down. So along with albuminuria, patient should have this type of debility as if she had or he had worked a lot. Then the if you see the eyes, it's a grand characteristic of kidney diseases that eyes are puffy, lids or conjunctiva red or edematous like swelling. So we can see that in different presentation of eyes, but the puffy eyes are indicative of again the kidney diseases. So we will get that in our totality. Then absolute thirstlessness is the grand indication. If you see on page number 64, thirstlessness with dropsy under stomach section, Dr. Patak sir writes. So absolute thirstlessness is the grand keynote we need to have over there. Then in urinary section under Apis mellifica, sir writes albuminuria, urine profuse more than he drinks. So patient will pass more urine than whatever he is drinking. Then I will like to draw your attention. Then cold air amelioration is there in Apis. You can consider that thing. Then right side is more affected than left. You have, if you have the reports of kidney means sonography of abdomen and pelvis. Then complaints are going from right to left. Then that also you can see in those things. Then patient is generally hot, relieved by cold bathing, cold air, cold application, uncovering. So these are the differentiating point among other remedies which are there in albuminuria pregnancy during. So you can think giving up is, but I will advise you a note of caution over here. that Apis somewhere I have read, I don't remember right now, but Apis mellifica should be used very cautiously during pregnancy because it can cause abortions. So whenever you are trying to give, or if the remedy is coming up like Apis mellifica or any of the complaint during pregnancy, especially during first trimester, then you must be very cautious. That is what I have learned up till now. I will like to draw your attention to one more thing under this remedy Apis mellifica. If you see under urinary only, then there is a line retention of urine in newborn. Okay, so I will request you to open page number 427 of Phatak repertory. Page number 427 of Phatak repertory. There is one rubric, you can write that in chat box. I can see chat box now. Dr. Vishal Zavne sir is asking me what about periodic albuminuria. Sir, I have never used this rubric, but I will try to clear this in our group only.
Sir, which page?
Okay, so the rubric, okay, retention birth at very good, Dr. Nikita Rana. So there is that rubric. I will again draw your attention to first we will look in this one, Matermedica, under female, under section female. The last line written by sir is ulceration of navel in newborn. So you will open page number 279 of Phatak repertory, page number 279, and let me know the rubric. You can write out that rubric in chat box. Very good. Dr. Radhika
Naval
Agrawal, that's the right
oozing from
rubric, naval ulceration, newborn in. I just want to get your attention what rubrics are there scattered in Phatak repertory. That should be known to you. Then we will again read out the female section of Apis mellifica from Phatak. I will just read out those saline features. So first line written over there is amenorrhea of puberty. You can also see this remedy and rubric under Phatak's repertory. If it is not there, you can add this remedy over there because it is the first line written under female section. Then if you come below in female section of Phatak Matermedica, then abortion during early months. So I was saying rightly, somewhere I have read about this, that this should be what we can say, this should be this should be used very cautiously during first trimester. Then drops in latter parts of pregnancy with puerperal convulsion. So puerperal convulsions are there, albuminuria there. This is the perfect picture in pregnancy where you can prescribe Apis mellifica very surely. So we have I think we have covered all in all Apis mellifica's indication in albuminuria during pregnancy. The next remedy in this list will sorry, I have forgot
Sir,
one thing, that
yeah.
profuse urination in spite of absolute thirstlessness. It is there in Apis, but in some Matermedicas, if you see, then there is also scanty urination is written over there. If you are getting scanty urination along with other features what we have talked about, then also you can consider Apis mellifica. Just patient is not having profuse urination and you are skipping to give Apis mellifica, then it will be a wrong thing. So that should be keep in mind. Then the next remedy which is used very frequently in such a conditions is Thalassobursa pastoris. So the name is different because Dr. Phatak sir was the follower of Bogar and Bogar synoptic key. So the abbreviation used in Phatak repertory are taken from Boger's synoptic key. So, Thalassobursa pastoris, this remedy you will get in Phytolacca Remedica on page number 143. And that is not in the alphabetical order of tea. It's written as Bursa pastoris, page number 143. Dr. Sadia Said is asking, how do we differentiate it from the rubric naval moisture act? This is simple thing. Moisture is different and ulceration is different. Dr. Ronin Levy, sir, is asking me, sir, do you consider abyss as dangerous to give in pregnancy? Sir, yes, sir. In first trimester especially, and first part of what we can say the second trimester. Yes, I will consider to give it dangerous to give apis mellifica in those days, because it has a tendency to cause abortion. But if it is surely indicated, if you have indication, then you can surely go with whatever potency you want. So the page number 143. So where the Thalassobursa pastoris will be indicated, so it is indicated in ill effects of suppression of hemorrhage or vaginal discharges. So you have the history before pregnancy that patient was having what we can say metrorrhagia or dysfunctional uterine bleeding. She has taken some treatment for that, or she was having the complaint of leukorrhea, which was suppressed by local applications or taking oral medications, and then she got pregnant, and then during that pregnancy, if she is suffering from albuminuria, then you can think of this remedy, that is Thalassobursa pastoris. But hematuria is there, which is marked, which was not there in what we can say in apis mellifica. Then dysuria will also be there, which is there also in apis mellifica. So you can compare like this one. Then the next remedy comes in this list is Helonias. So you will open page number 344 from Matremedica. So Dr. Patak sir writes the first rate is a remedy for females who are unduly exhausted by frequent pregnancies. So you will keep in mind a patient who is pregnant for 4 times, 5 times, 6 or 7 times. And in that cases, if you are getting albuminuria, so Helonias should be the first remedy to strike your mind. So we are differentiating this. So the lady will be unduly exhausted by frequent pregnancies, abortion, innervated by indolence and luxury or domestic work. So there are two things in Helonias. What means what we can say, the ladies which are living in luxurious life, but they don't have a history of such a things, then you can think of Helonias if they are coming with albuminuria. And if they are working ladies or they have more work in their home, they don't have any type of luxury, but they are doing work, domestic work day in and day out, or if they are going for a job, you can consider example of a female doctor or a female who is going in office for her work. She is coming to the home and she is also doing that domestic work, and she is exhausted by that and having the history of many pregnancies or abortions. So, and consider these cases in later ages of pregnancy, usually. Means you don't think in India, especially I am talking about, you don't expect that the ladies who are having the first pregnancy or second pregnancy at the age of 25 or 30, and you are considering Helonias. Then under urinary, if you read under Helonias, so Patak sir writes, urine profuse, clear, albuminous, saccharine. So saccharin, what does that indicate? That indicates glycosuria. So old aged female with history of abortion, with gestational diabetes, or she was having diabetes before that, then the urine is phosphatic, or she is having nephritis of pregnancy with obstinate vomiting. You can have a total all in all picture. If the patient is of such a combination, 3 or 4 symptoms you are getting, you can differentiate very well this remedy from the other remedies. Then, yeah, I will want your attention to to read one line under female section of Helonia, that is uterus heavy, sore, tender, ulcerated, or prolapse. But I want to I want to have your attention on or malposition. So malposition in such a female. We have already talked about the constitution of that female, how she will be. If you are getting malposition in 4th or 5th pregnancy of that female, then you can consider this remedy. And this malposition or maldisposition is the rubric on page number 432 of Patak repertory. You can open and you can see whether Helonias is there or not. So we are already differentiating this along with that also. Dr. Sadia Said is asking me, as nephritis is pathological condition, what potency? Madam, 6C. To start with frequent repetition. TDS or like that. And you need to monitor those patients closely on day-to-day basis. Aarti Parab ma'am, page number 432.
Sir, repeat please.
Sorry. Sorry. That must not be the 432. It's under fetus maldisposition. Just wait, I'm just confirming. Sorry, you need to add this remedy. There is only one remedy. Pulsatilla is there. You need to add this remedy Helonias, but you can differentiate this remedy from Pulsatilla. And what I have talked about over here, uterus heavy, sore, tender, ulcerated, or prolapse. For that version, you can get the rubric on page number 432. That is uterus prolapse. There is one remedy. There are multiple remedies, and one is there of Helonias. So you need to add Helonias under the rubric fetal maldisposition of on page number
159.
page
159.
number 159. Yes, Dr. Nikita, yes, it is page number 159. If this meeting ends, we will start next meeting within 5 minutes. I think 1 minute is only remaining. Then the next rubric comes in this. The next remedy comes under this rubric is Mercor. It's the most important remedy you will use for this presentation. You will need to go on page number 473 for Mercor. So under urinary,
Page
if you
number,
read
sir?
over there, then you can see tenuousness of bladder, then intense
Page
burning
number,
of
please,
urethra.
Shivali.
Same intense burning you will also see in Cantharis. I will compare this remedy with Cantharis in upcoming just after this session.